Welcome! The purpose of this e-module is to provide a framework for selecting planners and/or faculty based on target audience, learning objectives, and expected outcomes.
Today, we're going to talk about listing who qualifies as potential education planners or faculty, employing creative strategies to seek planning input, and creating interprofessional planning committees and educational agendas.
Why is planner and faculty selection so important? It's important to ensure a comprehensive perspective of the practice gap and ability to appropriately target the education to the intended audience. It is also important because it ensures the faculty is representative of relevant perspectives and scopes of practice. When selecting planners and faculty, there are 4 areas to consider: practice gap, target audience, expected outcomes, and identified experts.
Practice gaps. When reviewing your practice gap, what source of information did you use to define your practice gap? Also, who are the experts involved in the data generation or current practice that can help provide input?
Expected outcomes. What do your learners need to know how to do and demonstrate, and also who do they need to collaborate with to be successful?
Target audience. Does the gap require education focused on the competence or performance of a specific group of providers? Or does the gap require improved teamwork across the healthcare team?
Identify experts. Are the ideal experts internal or external? And what role is there for patients, administrators, public health officials, and other non-traditional experts?
Specifically, who can be faculty?
Anyone.
Sharp CME is accredited with commendation, meaning we need to demonstrate the ability to provide CME that addresses 8 of the 16 wedges that you see on this wheel. Selecting a range of planners and faculty can help us meet the criteria under promotes team-based education, and in some cases, addresses public health priorities. Let's explore the criteria associated with promoting team-based education. Criterion 23. Members of interprofessional teams are engaged in the planning and delivery of interprofessional continuing education. The emphasis here is designing and executing education that focuses on improving how the team works together by clarifying roles and responsibilities and the most effective way to collaborate among other aspects of team-based care.
Criterion 24. Patients or public health representatives are engaged in the planning and delivery of CME. It is important to note that patients and public health experts need to be involved in the planning and delivery of the education to meet this criterion. If you are doing one or the other, it is not enough. We will discuss this later, but engaging in planning does not have to mean attending planning meetings.
Criterion 25. Students of the healthcare professions are engaged in the planning and delivery of CME. Students can have a unique perspective that can add depth to the education. Professionals in training are often on the pulse of the latest information and can be a resource for presenting this information to seasoned providers. Any student selected as faculty should be supported by their preceptor in content development.
Addressing barriers. Making it easy for people to participate in the planning process means eliminating barriers. Common barriers include lack of time to participate or ability to travel to meet in person. Another challenge is lack of familiarity with surveyor resources, or the tools utilized are too difficult to use. Additionally, while using data is important, there is a lot of it, so deciding where to focus can be a challenge. Finally, is your planning space a safe place where all are welcome to speak up? Considering these when looking at ways to get planners involved can make planning more effective.
What are some ways to get planner input besides meetings?
To eliminate time or travel barriers, consider having online meetings or using discussion boards to facilitate input and conversation. To address survey fatigue, be creative in soliciting input using new techniques such as focus groups, gallery walks, or app-based tools. Take advantage of patient, organizational, or community data to guide activity development, but be sure to have a focus so that you do not get lost in big data. You may also take advantage of other activities where stakeholders are already meeting and get feedback from them at that time. Examples at Sharp may include surveying through the Insight community or getting input at the annual Women's Conference.
Faculty variety. What are your geographical considerations? Local, national, international? What kind of patients or public health representatives could be necessary? Are they medical professionals, non-medical professionals, students? Do all provider presenters need to be physicians? Can they be PAs, NPs, pharmacists, social workers? The most important thing is to design an activity that will lead to your expected outcomes using a range of faculty perspectives.
To summarize, the three main takeaways are: maximize planner input from all relevant stakeholders, utilize a broad perspective when identifying and inviting faculty, and consider using patient voices and other stakeholders that influence the identified target audience. To learn more, please view our references and resources.
Thank you. Let us know how we can help.